If you feel like something down there simply will not come out, no matter how long you sit, no matter how much you strain, no matter what you try, I need you to stay with me right here, because what I'm about to share today could change your mornings, your comfort, and honestly, your overall quality of life. Most people do not know this, but that stuck, painful, won't budge feeling is not always just constipation. It has a name. It has a specific physical mechanism. And it has a set of targeted solutions that most doctors simply do not have the time to explain in detail. By the end of this video, you're going to understand what may be happening inside your body, and you'll have 6 practical strategies you can start using right away. Before we go any further, I want to hear from you. Drop your first name and your age in the comments right now, and tell me how long you've been dealing with this. You would be amazed how many people are watching this and quietly dealing with the exact same thing. You are not alone. And please subscribe and tap the bell so you never miss a video that could genuinely help you or someone you care about. Let me start with something that may surprise you. Most people, including many of my patients the first time they come in, use the word constipation as a catch-all term. Hard to go? Constipation. Haven't gone in several days? Constipation. Feel like something is right there but it won't move? Also called constipation. But those last 2 situations can actually describe something more specific, fecal retention, or in more advanced cases, fecal impaction. And if you treat those situations the same way you treat ordinary constipation, you can actually make the problem worse. Here is the anatomy most people were never taught. Your large intestine is basically a water absorption system. As waste moves through it, your colon keeps pulling water out, gradually forming solid stool. By the time that stool reaches the final section, the rectum, it should be formed but still soft enough to pass without a struggle. The rectum is not just a straight tube. It has a curve, almost like a bend or kink. And when you sit upright on a standard modern toilet at roughly a 90-degree angle, a muscle called the puborectalis helps maintain that bend. When you're walking around during the day, that is useful. It helps keep everything where it belongs. But when you're trying to have a bowel movement, that same muscle can work against you. It creates a partial pinch at the exit point. That is the part nobody explains, and it helps explain why millions of people feel like they're straining at nothing. Not because they're broken, not because they're doing something wrong, but because they're fighting their own anatomy. And here's where it becomes a bigger issue. When stool sits in the rectum too long, whether because of that mechanical kink, dehydration, or slow gut movement, the colon keeps doing its job. It keeps absorbing water. As more water is pulled out, the stool becomes drier, harder, and more compacted. And the harder it gets, the harder it is to pass. So it sits longer. Then even more water gets absorbed. And that becomes a cycle. In older adults, this cycle is especially common and especially problematic because the natural muscular contractions that move stool forward slow down with age. On top of that, many medications commonly prescribed to older adults, including certain pain medicines, iron tablets, antidepressants, and some blood pressure medications, can slow the gut even further. And many people are mildly dehydrated for most of the day without realizing it. One study published in the Journal of the American Geriatric Society found that fecal impaction, the more severe form of this problem, accounts for a large share of fecal incontinence cases in older adults. Think about that for a second. What looks like a leakage problem is sometimes actually a blockage problem. Softer liquid stool can seep around a hardened mass that is stuck in place. If someone only looks at the symptom and not the full picture, they can miss the real cause entirely. So now you understand what may actually be happening. But the question that matters most is this: what can you do about it, starting today? And the first solution is so simple that many people tell me they wish someone had explained it to them 20 years ago. The first strategy is not a medication. It's not a supplement. It costs almost nothing. And when I tell patients about it, about half of them laugh at first, and then they come back later and tell me it changed everything. It's a footstool. I'm completely serious. Remember that puborectalis muscle I just mentioned, the one that keeps the rectum kinked when you're sitting upright? When you raise your knees above the level of your hips, that muscle relaxes. The rectal angle straightens out, and what felt stuck suddenly has a much clearer path out. This is not a trend. It is simple biomechanics. Studies published in the Journal of Clinical Gastroenterology have shown that a squatting or squat-like position, with the knees elevated, can reduce straining, shorten the time it takes to have a bowel movement, and improve the feeling of complete emptying compared with the standard seated position. You do not need a fancy product. A basic step stool about 6 to 9 inches high placed in front of the toilet is enough. Use it every time. For some people, the difference is noticeable from the very first use. If this is already helping, type the number 2 in the comments. I do read the comments, and if this information is new to you, then you are exactly who this video is for. Now, the footstool helps with the mechanical side of the problem. But there is another part of this issue that has to do with the stool itself, and that brings me to the second strategy, hydration, but not in the vague way people usually talk about it. Yes, you have probably heard drink more water 1,000 times. But the real mechanism matters here, and so does timing. Your large intestine absorbs water out of the waste moving through it. If you are well hydrated, stool is more likely to reach the rectum softer and easier to pass. If you are even mildly dehydrated, the colon pulls more water out, leaving behind something that can feel like a dry brick. Now here is the part most people miss. Drinking more water today will not instantly soften stool that is already hardened and sitting in the rectum. That stool has already been processed. Better hydration helps prevent the next stool from becoming equally hard. But if you need more immediate help in the morning, warm liquid can be very useful. A full glass of warm water, or warm herbal tea, first thing in the morning can help stimulate what's called the gastrocolic reflex. That is the reflex where your stomach signals your intestines that new material is coming in and it is time to move things out. This reflex tends to be strongest in the morning, and warm liquids can make it more effective. It is one of the simplest and most reliable morning tools I know. Now let's talk about the third strategy, because this is where people often make the wrong move. Not all fiber works the same way, and if stool is already getting stuck, choosing the wrong type of fiber can backfire. There are two broad categories of fiber. Soluble fiber dissolves in water and forms a gel-like substance in the gut. That gel helps hold moisture in the stool and can make it softer and easier to pass. Insoluble fiber does not dissolve. It adds bulk and helps move things along. Both matter, but when stool is already hard and getting stuck, soluble fiber is often the better place to start. If you add a lot of bulk to stool that is already compacted, you can increase pressure without actually softening what is there. It's a little like trying to force a dry cork through a narrow bottle by pushing even more material behind it. Two foods stand out here. The first is prunes. Prunes contain sorbitol, a natural sugar alcohol that draws water into the intestines, and they also contain compounds that can help stimulate bowel movement. Clinical research has shown prunes can be quite effective for improving stool frequency and consistency in people with chronic constipation. The second is kiwi. 2 kiwis a day, ideally if tolerated, can help with stool consistency and frequency as well. Some studies suggest kiwi works as well as psyllium for many people and may be easier to tolerate. So if your stool feels dry, hard, and difficult to move, think softening first, not just bulking. Those first 3 strategies work together. The footstool improves your body position. Warm liquid helps trigger motion. The right kind of fiber helps improve the stool itself. But the fourth strategy catches many people off guard, because it has nothing to do with what you eat or drink. It has to do with what your body does when you move. Walk before you go. Your intestinal wall contains its own network of nerves, often called the enteric nervous system, sometimes nicknamed the body's second brain. This system helps control the contractions that move stool through the intestines, and it responds to physical movement. When you walk, stretch, or do even light activity, you help stimulate gut motion. When you sit for long periods, everything slows down. For older adults dealing with stool retention, one of the most evidence-supported habits is a 15 to 20-minute walk after breakfast. Why after breakfast? Because that is when the gastrocolic reflex is already active. So now you are combining food-triggered movement in the gut with whole-body movement, and together they help create a natural wave that moves stool toward the rectum. I had a patient I'll call Mr. Gerald, 71 years old, retired, who spent most mornings in his recliner with coffee and the newspaper. He was having a bowel movement every 3 to 4 days, and each time felt like a major ordeal. We changed one thing. After breakfast, he started taking a 20-minute walk. That was it. Within 3 weeks, he told me he was going comfortably almost every morning. He said it felt like someone had flipped a switch inside him that he never knew existed. If that one is clicking for you, type the number 4 in the comments below. I'd love to know which of these strategies is standing out most, because your comment also helps this video reach more people who need it. Now here is the 5th strategy, and this one deals with a problem that can quietly build for years. Stop overriding the urge. Your rectum contains stretch receptors, little nerve endings that send a message to your brain when stool enters and stretches the rectal walls. That message is the urge to go. It is your body saying, now is the right time. But that signal has a window. If you respond to it, your body coordinates the process. If you ignore it because you are busy, because you are not home, because you want to wait until later, the signal fades. The rectum adapts to the stool sitting there. The urge gets quieter. And if this happens over and over again, those receptors can become less sensitive. The threshold rises. Eventually, some people stop feeling a strong urge at all, even when stool is sitting right there in the rectum. That condition is sometimes called rectal hyposensitivity, and it is one of the most common but least discussed reasons people deal with chronic stool retention. The solution is simple, but it requires consistency. When the urge comes, respond to it whenever you can. Every time you respond, you strengthen that pathway. Every time you ignore it, you weaken it. And if your urge has already become dull, you may be able to retrain your body with scheduled toilet time. Sit on the toilet with the footstool in place for about 10 to 15 minutes after breakfast, when your gastrocolic reflex is naturally strongest. Do not force. Do not strain. Just sit, breathe slowly, and give your body the opportunity. Many people find that with several weeks of consistent practice, the signal starts to come back. Now, all of that covers the lifestyle and behavior side. But there is also a sixth strategy, and this one is for when things have already progressed to the point where stool feels right there, close to coming out, but it simply will not move and you need relief. This is where I want to be very clear, because people often make desperate choices in this situation that can make things worse. When you are already stuck, one of the better supported over-the-counter options is polyethylene glycol, sold under brand names like Myra LAX. It works by drawing water into the colon, helping soften stool from the inside. It is tasteless, easy to mix into water, and for many adults it is a reasonable short-term option. Another targeted tool is a glycerin suppository. This works directly in the rectum, where the problem may actually be. It helps draw fluid into the area and can also stimulate the urge reflex. When stool is specifically retained low in the rectum and feels close but immovable, a glycerin suppository can be one of the most direct and fastest non-prescription options. What I want people to be careful with is regular use of stimulant laxatives like Senna or Bisocodyl. Used once in a while, they may be appropriate. Used over and over, they can create dependence and may, over time, interfere with the gut's natural ability to move stool on its own. And please hear me on this, straining harder is not a strategy. Forceful, prolonged straining increases pressure in ways that can contribute to hemorrhoids, fissures, and in some cases rectal prolapse, where part of the rectal lining pushes outward. Those complications are real, and they are often avoidable. And this is a good place for a quick pause. If this video is helping you, please share it with one person. A friend, a spouse, a sibling, a parent, someone you suspect may be silently dealing with the same issue. Most people never talk about this. Too many people suffer quietly when they do not have to. One share could genuinely help somebody. Now I need to tell you something just as important as the 6 strategies we've covered, because while most stool retention can be managed at home, there are times when this stops being a home problem and becomes something that needs medical attention promptly. If you notice blood in the stool, get checked. Bright red blood may be hemorrhoids, which are common, but it still deserves evaluation. Dark, tarry stool or blood mixed throughout the stool is more concerning and needs urgent attention. If you develop new constipation suddenly, especially after age 60, and it is persistent or unexplained, that needs to be taken seriously. A major change in bowel habits can be one of the earlier warning signs of colorectal cancer. I do not say that to frighten you. I say it because when colorectal cancer is found early, it is one of the more treatable cancers we deal with. If constipation comes with unexplained weight loss, that also needs evaluation. If you have severe abdominal pain, vomiting, or you cannot pass gas at all, those symptoms may point to a bowel obstruction, which is a true emergency. And if you ever feel like something is physically protruding or coming out during straining, that may be rectal prolapse and should be evaluated by a gastroenterologist or colorectal surgeon. I share those warning signs not to create fear, but because I have seen people delay care for months out of embarrassment, and sometimes the thing they were hiding turned out to be far easier to manage earlier than later. Your comfort matters. Your dignity matters. Your health matters. Do not let embarrassment make medical decisions for you. Now let me tie this all together, because I want you to leave this video with a system, not just a random list of tips. The footstool fixes the mechanical problem created by the toilet position. Warm liquids in the morning trigger the reflex that helps set the gut in motion. Soluble fiber helps soften what is forming. Movement after breakfast helps drive it forward. Responding to the urge keeps the body's signaling system sharp. And knowing your safe short-term relief options means you are less likely to panic and make things worse. These are not isolated ideas. They support one another. I once had a patient I'll call Evelyn, 72 years old, who came in for a blood pressure follow-up and only mentioned her bowel problem at the very end of the visit, almost like an afterthought. She said she had not had a truly comfortable bowel movement in more than 2 years. 2 years. She had told no one. Not her husband, not her children. She had been quietly using stimulant laxatives every few days and had slowly come to believe that this was just part of getting older. We went through the exact same things we talked about today. She was not drinking enough. Her fiber pattern was off. She spent most of the day seated. She had been ignoring the urge for years because life felt busy. She had never heard of the puborectalis muscle, and no one had ever explained why a footstool could matter. 6 weeks later, she called the clinic and told us she was going comfortably every morning and couldn't believe she had waited 2 full years to say anything. The conversation was not the embarrassing part. The silence was the costly part. So here is what I want you to take from today. Stool stuck in the rectum is not always just constipation. It has specific causes, specific mechanics, and specific solutions. Fix your position with a footstool. Trigger the morning reflex with warm liquid. Lead with soluble fiber. Move your body after breakfast. Respond to the urge when it comes. And know the safer short-term options if you need extra help. That combination can make an enormous difference. And there is one more thing we did not fully cover today, but it is important. For a meaningful percentage of older adults, especially women, no amount of fiber or hydration completely solves this problem because the issue may involve the pelvic floor muscles themselves. That is a deeper conversation, and it is one I want to cover in the next video. I'm Dr. Anthony Fauci, and if this helped you today, please give this video a thumbs up, share it with somebody you care about, subscribe so you don't miss what's next, and leave a comment with your name, your age, and which strategy you are going to try first. I read every single one, and I'll see you in the next video.